Welcome to XReality Podcast. I'm the host, Dominic Wu. Each week, we will have conversations with industry leaders to explore the unexpected connections and opportunities between diverse sectors and the world of spatial AI and XR. Today, our guest is Dr. Harvey Castro. Harvey Castro's journey led him to become a physician, a decision that reshaped his life trajectory. With over 20 years of experience as a physician, entrepreneur, and former CEO of a healthcare system, Harvey has made significant strides in healthcare management, collaborating with physicians and integrating advanced healthcare practice. Currently, Harvey is at the forefront of healthcare's AI revolution, serving as a strategic advisor for GPT and healthcare. His mission is to integrate healthcare professionals, AI developers, and pioneer AI technology seamlessly. Thank you, Harvey, joining us today.
Thank you for having me. We've been trying to schedule this for months, and I was excited about today. So finally, we got to get together and chat.
Yeah, cool. So, yeah, I read your book, Vision Pro for Healthcare. And for me personally, I feel very inspired because as a developer or creators in XR fields for so many years, my approach usually start with the technology. I know the technology and I start building up and learn from other sectors, from other knowledge and start building up. But if you got a chance, please get like Dr. Harvey's book, Vision Pro for Healthcare. This book is just blow your mind because it's from doctors, physicians' perspective how he want the technology to really help bridge the gap for the healthcare. Like right now, we start like I would say because Vision Pro is still at the beginning of I would say infancy of the technology. We keep kind of complaining, oh, like this is too heavy or something. But I think in the book, it mentioned a lot of really amazing, innovative ways that I haven't really heard from previous physicians in my podcast. So I would like to dive into those interesting use cases and also learn more from Dr. Harvey's vision for how spatial AI can help bridge the gap for medical surgery or healthcare. Thank you. What's your journey of being where you are today?
Honestly, first of all, thank you for having me. Honored to meet you finally and spend time. And, this journey has been a lifelong journey. To go way, way back, I'm going to just not go all the way back, but I'm going to go to the iPhone. I was playing with the iPhone, and it was the first iPhone that had just came out. And at the time, I was in the emergency room, and a patient came in and wasn't breathing, and so we had to start CPR, and we started medications. And I told the nurse, "We need to start this special IV." And when I told her the nurse, she said, "1 second, doc." She went and got a textbook, started thumbing through it, started looking, and said, "Okay, minute," and then got a calculator out, verified, and I said, "Okay, let's go." And I'm looking at her thinking, that's taking too long. And I'm looking at my iPhone thinking, what if I put all that information on this phone? And so I was the first person in the world to write a book on IV meds, and within 3 taps, boom, you got the medicine. And so fast forward, I'm throughout my life, I've been blessed. I've been a CEO for multiple healthcare companies. I've been an entrepreneur where I was able to grow emergency rooms into about 8 locations. I had 350 employees. I had my own staffing company, billing company, physician company, marketing company. And then all those years of experience and technology fast forwards to the moment when it was November 30th. I was in this office and I'm playing on the computer, looking at some stuff, and I'm like, what's this chat GPT that was on my radar that day? And I started playing with it, and my mind blew up. I thought, oh my gosh, this is going to change healthcare. This is going to make a new world out of healthcare. And so I'll never forget. I went running to my wife. She was in the kitchen and we were talking. I'm like, honey, ChatGPT just came out. I'd never heard of it, but I'm going to write a book on it. And I see
Mm.
how to use this in healthcare. And I'll never forget. She looked at me and she's like, honey, no, 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 no. Nobody knows what you're talking about. I have no idea what you're talking about. And you want to write a book on this thing? So then I explained it to her, and she's like, "Ooh," she's like, I love you to death. I just don't want people to think you're crazy. I don't want people to think that this is just something that's out there and you're gonna look silly out there." And I said, "Oh," so I kind of hesitated. Long story short, I ended up writing the book and having it published within 3 weeks.
Wow,
And
yeah, because I saw like last time I saw your book on Amazon. It's not a lot, but today or yesterday I revisit your book session. It's like wow, numbers of it, and I think it's within high quality because when I jump in to read a little bit, I find out like wow, every single book has its own unique point of view. So yeah, I understand that your like ability and also your vision in different sectors and also potentially I don't know with the AI help so you are very productive like wow suddenly everything like a just like a explosion.
yeah. And so my journey honestly took me from my background as a doctor,
Hmm.
later as a business owner, and then now with AI, I was
Yeah.
able to put all those worlds together.
Wow.
And it's given me sight and being able to say things and do things.
Yes.
Like you mentioned right before we started, she's like, Harvey, some of the stuff I've interviewed other doctors and I've never heard
Yeah.
of any of this. And
Yeah,
I
right.
and I feel blessed because it's me reading and studying AI. So I know the science really well. I went back and got some certificates. I'm a professor at a university.
Mm,
But then I'm combining what I know of AI
mm,
into actually creating my own products. I have a developer
mm,
as my business partner, and we develop together and we work. And so it's getting funny because I used to do iPhone apps. I had about 40 that I developed. So when
mm,
I speak to him, I
mm,
speak to him how it should be done, and he tells me how he thinks it should be done. And it's a great conversation because I'm
mm.
looking at it with the doctor's eyes, with the user
Yeah, top
interface.
down and bottom up. Yeah.
Yeah. And the nice thing is, like you said, I can meet him halfway. When he speaks to me, it's not over my head. I understand, I know
Mm,
what he says and the limitations and the user interface, but then it's he's looking at it from the computer version. I'm looking at it from the doctor and
yeah.
computer, and then he's meeting me halfway. So it's so much fun because,
Yeah.
to your point, I'm able to look at something and say, "Oh my gosh, we can
Yeah.
use this in healthcare." The
Yeah.
latest thing I noticed, I saw this Hugging Face where it's using sign language
Mm,
LLMs,
yeah.
and I told them, I'm like, oh my gosh, we're going to add this to my next presentation. So we're going to convert one of my slides into sign language because the LLM
Wow.
can do it. And I
Wow.
thought,
So
how
are you
amazing.
going to do sign language and use like a LLM to translate and make everything? Well, that's
Yes.
incredible. Yeah.
Yeah, so I'm gonna do one slide that way.
Hmm.
That way, when I'm on stage giving talks
Hmm.
about how to use AI, I'm
Yeah.
gonna give an example of, look, if I have someone that can't speak
Hmm.
or can't hear me very well,
Yeah.
and I don't know sign language, why
Yeah.
not have this LLM? And as
Yeah.
I'm speaking on the
Yeah.
computer screen, it could be doing sign language, and I don't need a translator. The computer will be that. And I want to show again proof of
Wow.
concept. And
Hmm.
this was something so simple. I saw this research paper. I was reading it. I was like, oh my gosh, we should do this in
Wow.
healthcare. And so
Yeah.
immediately I was calling them. I'm like, we're going to do this. We're going to work on this and we're going
Wow.
to put it out there. So, I've been around the world giving talks. Now this will be added to my talk. So when I'm out there on stage, some physician, some hospital CEO is going to see this and think, oh
Yeah.
my gosh, yes, we should have this.
Wow, wow. I think you are constantly looking at the new technology and combine your previous medical experience and entrepreneurial experience, of course, start inventing new use case for a lot of different things that is very amazing. And I think just like you said that for developer or creators, we tend to see the limitation. And when I saw you mention tons of study cases because normally people usually emphasize one. For example, patient, right? How to explain to patient or record doctor notes, but I saw you have like a, I would say almost a full stack of the things. Start from diagnose to explain to patient and to like a telemedicine and create the personal like a medicine. Yeah, so all those like really amazing, and also you pointing out like what's pros and cons. Do you want to kind of give us like a briefly what
Yeah.
you think about like a Vision Pro and like your vision for it?
Yeah. So no pun intended. This is the look of what the book looks like. So anyone out there that wants to get it, it's on Audible, Kindle, and on paperback. And what makes this book so special, honestly, is I'm bringing AI and seeing VR, but then I'm putting healthcare. And I really think the end game of this is not for money, it's not for profit, at least not for me. The goal is 100% the patient. And I've seen patients, I've been doing this for over 20 years. And so my goal with the book was, let me give some ideas of how I see AI, how I see VR, put it together, and let's put those ideas on a book so that someone like you would read it and be like, oh my gosh, I can
Ah,
make this or I can make that. Hopefully, you'll call me and be like, hey, Harvey, let's work on this project together. Let's
yeah,
build
I
this
would love to
because,
like have another call with you because I've been always because the main goal for this podcast is to explore the use case for what this technology can do to help other industry bridge the gap. So I think this is perfect. I would definitely love to follow up. Yeah.
yeah, yeah, awesome. And so my vision to your point is let's work on some low-hanging fruit, some things that the public can use, the hospital system can use, because we have a crisis in this country and actually the world. We don't have enough healthcare professionals.
Yeah.
We have so many more patients. And as time
Yes.
continues, the patients are only going to get older and older, and there's going to be less and less physicians and nurses and support team. And so my goal is let's use these tools, let's combine AI, let's put VR together, and let's give those tools to the society. So that way our doctors aren't retiring early, our nurses are not retiring early, our patients are getting better health care, and let's use these tools to help humanity.
Wow. Yeah. So, can you give us a little bit like how Vision Pro can help with diagnose? Like I
Yeah,
saw like you mentioned a lot of different things. Skin
yeah.
cancer. Wow, this is first time I learned from it. And also some neurology types of like disease. So how do you envision this
Yeah,
with the diagnose? Yeah.
great. I'm gonna grab my Vision Pro. So, I love the Vision Pro. Yes, it's expensive, but this is how I see it. Let's talk about skin cancer.
Mm,
If I'm your doctor and I have these on,
mm,
and let's say I'm older and I need glasses and I can't really see that well, so I have a little magnifying glass. I have glasses to help me. Now, this
mm,
device in the virtual, I can start expanding it and I can see this
mm.
small little area on your skin the size of a 100-inch screen on
Oh.
this. And so, what if I took that image and I paired this with another database
Mm,
that has how to read what it's seeing?
mm.
And it's already existing. And
Yeah.
then it's pairing this with the AI. And
Yeah.
now it's looking at the skin, the edges, the rays, and whatnot. And now it's able to feed it to that database and in real time give it back to the Vision Pro. And then I can see it on my screen where, and doctors call it the differential diagnosis. These are the different things. And so now here's where the money's at. Here's the magic.
Mm,
It is what AI is telling me,
mm,
my human, so
mm,
it's human plus AI
mm.
is better than just human or just AI. And
Yes.
so what I'm saying here is having that example where I can put these on, pair it with AI, and maybe the AI gives me some things that I didn't think of. Or
Mm,
maybe it's wrong and I'm like, you know what? This is wrong and here's why. But now that's being trained, going back to the database. And now when someone else is using it or myself, now it knows what I
mm.
just corrected with it. I mean, that is the power of this technology.
Wow. So, just echoing you said that it can really helps like doctors because when I saw you describe a Vision Pro, you have a vision for Vision Pro, which I think the Vision Pro is not there yet because what you mentioned is that oh, someone need to or like take a shot of the skin. And so far as I know like a Vision Pro wants to do more healthcare, since you see Apple Watch and all those like a device that has a lot of like apps to have all the data of someone's like a breathing or heartbeat or like a exercise, those types of data. But I think your vision is much ahead of what technology currently can do. So that's why I think we need more people like you to give us more like, hey, directions instead of just sticking on our current technologies. Yeah, so those are great usage. And the other thing that you mentioned is like a for eye doctors, right? That word is too hard for me to pronounce, but the eye doctor is easy. So how do you envision that for person or physicians to help
Yeah.
cure people's eyes or diagnose? Yeah.
Yeah, I'm gonna gently go back to what you just mentioned.
Hmm.
I think the technology is here. It's
Hmm.
just that it's not integrated. And
Oh.
I think AI models that I just mentioned with the dermatology exist. I
Hmm.
think the Apple Vision Pro can take that input and those high quality images
Hmm.
in, and it's just a matter of creating the bridge between AI and VR. And I think that's what's missing. But the technology is there. It's just a
Yeah.
matter of creating it. And then what I bring into it also is the workflow.
Oh,
Um,
workflow.
because as a doctor, some of these things that developers create may not be good enough for the workflow, meaning doctors would never do it or nurse would never do it. From an IT point of view, sounds like a great idea, but from a
Yeah.
practical point of view, sometimes it doesn't.
Mm.
Now, to answer your question about ophthalmology or
Yeah.
how the
Ophthalmology. Yes. Yes. That word. Yeah.
um, how does that work? The Apple Vision Pro is literally looking at your eyes, and the degree that it can see your eyes, it could see sometimes better than our naked eyes towards the eye.
Mm.
And so again, imagine being able to accurately see how your eyes are moving and
Mm.
swiftly. And so if I'm your doctor,
Mm.
one of the eye exams is I do a field vision with just my fingers. So I'm just
Yes.
going right,
Mm.
left, up, down. But if I could put this VR on you and the
Yeah.
machine is looking accurately at all your movement, it may be able to
Oh.
see small changes in your eyes that would be able to say, wait a second, when he goes to the left, the eye is not going fully to the left or is
Mm.
slowing down a little bit. There
Mm.
might be an impingement on that muscle.
Mm.
The other thing is, if I
Mm.
marry AI and VR,
Mm.
and my pupils are the camera's looking how big my pupil, the little black part in my eye is,
Mm.
and expanding the iris and that whole part of the eye.
Yeah.
If it could see that maybe one of the pupils is not closing the same amount as this one, now it would know, hey,
Mm.
this eye has something wrong with it. So there's
Oh.
subtle little things that we would need a machine to help us. Now I can look into your eyes and really kind of calculate and notice, but if it's so small that our eyes
Yeah.
can't see it, but the Apple Vision Pro can. And so that's why I'm
Oh.
saying this is only going to get better. Now,
Yes.
they haven't studied this, but if the Apple Vision Pro, if you can dilate the eyes, now this part is new. If we can dilate your eyes and get enough light into, there possibly could be a play here where you could possibly start seeing the back of the eye.
Oh,
You may need some,
wow.
and so now you can start seeing more. So that might that might require a little bit of more power inside the Apple Vision Pro, but that would be an amazing possibility. Could you imagine going to the doctor's office? They put on some
Yeah, instead
glasses
of like a
and
different machines and you need to sit this chair and there's
yeah,
another
go to the
person
different
in front of
machine. It's just
you.
one. Yeah.
Yeah, you just have one and also you can do it at home. You don't
Yeah.
even need to go to the eye doctor. And what I'm thinking is that maybe there's a virtual doctors. Maybe Vision Pro itself can have an app that do a lot of like a health check. If, for example, like there's an app called Eye Doctor app, and you just wear it, and it will help you to do anything. And if you like it, you can order immediately, like oh, your best like eyeglasses. But maybe there's a doctor needs to at the end prove or something. Yeah, like
Yeah.
make sure it's there's no problem. But yeah, I think
So
that's
so
great.
let's talk about that. We all
Hmm.
heard that the new iPhone, I don't know if you knew this, but you can look at it and if you have your AirPods on and say yes or no, they're going to start using the camera on your phone,
Mm.
similar to the Apple Vision Pro. So you
Mm.
might be able to control your phone with your eyes.
Oh, wow, I can control my phone with my eyes. Is that because I
The
have
next
like,
one,
oh, I have
the new one
14.
coming out.
Oh, the new
No,
one,
so
the
it'll be the
16?
15 and 16, and it'll be available on iOS 18. So the next one this fall.
Oh,
But
this
that's one of the
fall.
features. So
Wow.
imagine, let's pretend, God forbid, somebody has a stroke
Hmm.
and they can only move their eyes. So they
Yeah.
have their phone in front of them. With their eyes, they're able to manipulate
Wow.
the phone. So,
Yeah. Wow.
and imagine, and I think this is going to happen. I think
Hmm.
these Meta glasses, these are
Mm-mm.
the Meta
Oh,
Vision
red
Pro,
band?
the Ray-Ban
Hmm.
from Meta, and I could take
Yeah.
pictures and it analyzes.
Yeah.
And I think Apple's going to release this in the near future, and it'll
Yeah.
have technology of the Apple Vision Pro, but it'll be here. And I
Mm.
believe this will be a screen where I can
Yeah.
start seeing things.
Battery 61%.
Better. And rumor has said that Meta is going to release their like a new like AR glass that will blow your mind. So I believe it's something that you show, and which Tim Cook keep mentioning that he wants Vision Pro just like your Ray-Ban, like a sleek, fashionable, small, lightweight as possible. So yeah, I think everything all tied together. And imagine that, wow, like if for your eye exam or everything, it becomes like a part of it, or it becomes very important. I would say that Vision Pro equals the entire clinic place because it can do a lot of things. For example, in your book, you mentioned dental, right? When the doctor wear the Vision Pro, maybe the very small lightweight, and look at
Mhm.
somebody's teeth and can predict like cavity and all sorts of things. I remember when I went to dentist, I always need to open my mouth and start like doing a lot of like a really miserable things, make my mouth very hurt, and trying to examine things. What do you see how Vision Pro can help dental?
So I was in the U.S. Army,
Yeah.
and when I was 18, I was a
Hmm.
dental assistant in the
Hmm.
Army,
Hmm.
and so I actually went through training for dental.
Hmm.
And one of the things I see immediately is if I can put this on
Hmm.
and I can pull up your X-rays for your teeth, I
Hmm.
can see what your teeth look like before, I can go through your medical records in the virtual world,
Hmm.
that would be huge.
Hmm.
If I could take pictures, if
Hmm.
I'm your dentist and I can see through and take pictures of your teeth or different pathology, now it's already on my Vision Pro. So now it's a matter of pairing
Hmm.
the electronic medical record with the Vision Pro. And so I
Oh.
think it'll be a great tool to be able to track disease, progress of your teeth, something as simple as how white are your teeth. The Vision Pro would be able to, you can add an algorithm to it to
Hmm.
be able to see how white those teeth are.
Oh.
And so
Hmm.
when you're having bleaching of your
Cavity.
teeth,
Yeah.
you can see if it's more white or not. Or over time, if you're drinking a lot of coffee
Mm.
and tea, when you come back to your visit, the Vision Pro can automatically say, you know what, your teeth went down a shade or two. We probably need to bleach this if you want.
Wow, this is like I mean, everything we discussed today is, I would say, yeah, like my first time like discussing those types of very useful scenarios. So you also mentioned telemedicine. Can you tell us about like your vision for Vision Pro to help with
Yeah,
telemedicine?
yeah. One of the hard parts of being a physician using telemedicine is not getting enough data. And so if I could put the Apple Vision Pro, there's also a distance barrier. Right now we are on Zoom and I can't reach out and, touch you or, as a human being, give that human touch is gone.
Mm.
But if I can immerse you in the glasses and you have the feeling like you're in my office and we
Oh.
change your environment to feel like maybe we're in a cozy, nice, elegant office. Um,
Mm.
Now, when I see you, if I can in real time together go over your x-rays together. So you have a Vision Pro, I have a Vision Pro, and then I
Mm.
look to the left and it's your x-ray, it's your
Mm.
lab, and I can explain to you and then let's pretend that we have your CAT scan and we're looking at your heart or your lungs with the 3D imaging. And then I put it on the Vision Pro for you and I to see. and then I'm going through and showing you where I see the issue and I can blow it up. Now you're like, oh my gosh, I need to take my medicine. I see
Oh.
what he's saying to me. I don't know medicine, but he explained it. He showed me my heart. He showed me my lungs.
Hmm.
This is how I see telemedicine being even better because
Mm.
I can immerse you, I can share with you, I can teach you. The other thing is, let's pretend you live in another country and you speak another language.
Oh,
This is
yes.
where I say I use AI
Mm.
plus human and say I'm speaking in English, and let's pretend you speak Spanish. Now it's translating in real time, and you only hear me speaking Spanish,
Hmm.
and I only hear you speaking English.
Yeah,
But
I
the
can
AI
speak
can change.
Chinese, right? Maybe like
Yeah,
every language, and imagine it's a
yeah.
group and everybody speak different languages, but they can all see real-time translation. And also, yeah, I think this is mind-blowing. And also I interview another physician, but student physician. He mentioned that the hardest things for a physician is explain what's going on to the patient. And it's only like a patient visit is only 10 minutes. And he said his challenge is that because if inside internally, it's very easy to communicate with other physician or nurse because everybody knows all the terms. But when explaining to somebody who doesn't have the medical background, he said visualization is extremely important. And just by what you said, physician can educate the patient by syncing the electronic, like a patient, like a medical record. And also Gen AI can also, for example, generative AI, when physicians say something and maybe there's a AI 3D model generated immediately to explain the patient. For example, I say, oh, the lung, your lung, and 3D model generation immediately shows up. So I think this will be like a really amazing types of kind of like device and the way to use it. And also, you mentioned that monitor the patient remotely. Can you explain, give us more like how Vision Pro can help monitoring patient remotely?
Yeah, so with the monitoring, again, it's pairing. We all have our Apple Vision Pro, let's pretend. I mean, the the wrist, and we have Apple Health rather. And imagine that every time this device is recording my sleep, my HRV, my heart rate, my oxygen. If I have a sugar issue, it has my sugar. And so imagine if I paired this to my Apple Vision Pro.
Mm,
And so now either I'm a doctor or a patient,
mm,
that information is being fed from here to the device.
mm,
And so I can have this set up again with AI to
mm,
basically monitor. And so if it's within a certain parameter,
mm,
fine. But if it falls between the too high or too low, then there's an alarm to you. Let's
mm.
pretend that you're 80 years old and
Yeah.
maybe you don't really understand, but you're taking care of your mother or grandmother.
Mm,
Now you get a notification saying, hey, grandma's not well, her heart rate's starting to go down, she's starting to get a little fever. She normally doesn't get fever. Maybe it's time to take her to the doctor. And so this is
mm,
where a great example that maybe the VR, now I
mm.
can put them on and say, okay, I think we have to I see you, and I really think you have to come to the hospital. I want to do this at your house. Or if I'm an old-fashioned doctor that still loves house calls, then I come to your
Yeah.
house and I take care of
Wow.
you there.
Wow, so I think Vision Pro pretty much serve as a place, like clinical, huge, like the place that with a lot of heavy equipment. Vision Pro serve as a huge, like kind of like a small device, but with a super powerful computing systems that can help a patient to get all the data and get instant feedback. Yeah, so yeah, I really like how you envision all those like kind of usage. And also, we talk a lot about the pros of Vision Pro. How about the cons? Because in your book, you also mentioned like how Vision Pro can do better, like your opinion.
Yeah. So number one, obviously, it's the first generation, kind of like the first iPhone. Really
Yeah.
wasn't that good, but back then it was amazing. Same thing with the Apple Vision Pro. Number one, it's expensive.
mm,
So not every part of the hospital can use this.
mm.
For example, surgeons are using it because they have a higher budget. Neurosurgeons are using it to do the first neurosurgery case was literally the day after the Apple Vision Pro came out.
Oh,
And so we're using it, but it's an expensive tool.
yeah.
Example, I'm an ER doctor.
Mm,
And if I'm seeing you in the emergency room, I would love to have this on. But
mm.
the problem is, emergency departments generally do not make much money. And so the
Oh,
hospital
yes.
administrator is going to say $3,500 or $5,000 for this. I'm
Yeah,
not going to spend that money for this.
yeah,
And so it creates limitations.
yeah,
And so, to your point, the other obstacle is we need visionaries, someone that can
yeah.
see the future, can create these products, because
Mm,
if the product is there, no one's innovating, for example, creating apps or
mm,
functions for the device, then the
mm.
device doesn't grow. But
Yeah.
if you have amazing ideas that can the
Mm,
device can do,
mm,
man, now people are going to want it. So I do see in the future that the Apple Vision Pro will probably be a version will be of glasses.
mm.
This device will be cheaper.
Yeah,
And
yeah,
I really see that happening. Obviously, when the first iPhone price went up and then later the newer editions, that price went down.
yeah.
Eventually, all of this stuff will go down and down in price.
Yeah, so you see the price need to go down, and also previously you mentioned that it's not integrate really well right now. I would say right now. In the future, I believe, because at AWE, I just came back from AWE. It's one of the largest kind of XR expo in Long Beach. People mentioned that, Orin Bar mentioned that XR is the interface of AI. So AI is kind of like the backend algorithm, more invisible, but XR is like a spatial computing, is the visualization of what's the result. So
Mhm.
I can see like this can be implemented into like healthcare. And also I saw you have a book called AI Pin. You have a tons of book. Yeah, AI Pin. What do you think about AI Pin?
Yeah, so I'm looking for it. Let's see if I have it right here. Uh, I have the Humane AI pin,
Yeah, what do
and
you think about human? I saw a lot of like online YouTube critical stuff. I wanna listen to
yeah.
what you think.
So I see it as this. It's a
Mm,
proof of concept.
mm.
From a concept point of view, it's a pretty good idea. I know there's horrible reviews. I know it's overheating. I know.
People was
I
like, oh, like a listen to like a 30 minutes and not even respond and always not really
Yeah.
get to the point. Yeah.
But from my eyes, I see it differently.
Mm,
The fact that you could wear a wearable device in healthcare as a
mm.
doctor, I'll give you one quick example.
Yeah.
One of the common things that reason you shouldn't just go to the hospital if you don't have to is there's something called nosocomial infections. And all that means is that there's some really bad infections in the hospital, and you might get infected from it because someone else may have it, or something might get infected, some instrument it doesn't get cleaned correctly. So there's that. So the more I touch, the
Mm,
more I don't wash my hands, the more that spreads.
mm.
And so think how dirty our iPhones are, how much we
Yeah.
touch it. When's the last time everybody really do they clean it every day? Probably not. But if I have a wireless device that I can just tap and have a conversation and talk to it, or if you could put a wake word on it, now I'm really have a device that I don't have to touch. Now I don't have to spread. So that alone is huge. The second example, let's use the translation again. I know that Siri is getting better and I can translate with this, but what if I could just hit my Humane AI pin and have it speak to you in Spanish or Chinese, and then I speak in English and it translates and then tells you, and then vice versa. And it's right there on me. It's, obviously we have to make sure that it's HIPAA compliant, that no information is going to the cloud or some information that you may be saying. But assuming that that is, we secure that line, what an amazing tool. Because again, not everybody has an iPhone, not everybody has an Android. Some hospitals don't allow you to have these devices
Oh.
on you. And
Why?
so
Why?
imagine,
Why you cannot have like a those device on you?
yeah, it's more for privacy. They don't want you
Mm.
taking pictures of the patient, or if you do,
Oh.
that you take that
Mhm.
home and then who's securing it. There's a lot of reasons why you would want to do that. Obviously, people are going to still have their phones, but depending on the situation and what's going on, some places ask you to put it in your locker and come to it later.
Wow.
So there's just other reasons why it would be nice to have something like that. The other part is the vision. Imagine taking a picture of something and saying, hey, look at this EKG and tell me what you think, to be able to get the analysis. This week, I like toys. I just got my rabbit.
Wow,
R1.
wow. How do you think about rabbit? Wow, you are such a very interesting combination of medical and tech. Because normally doctors, this when I saw your profile, I find out that actually, like, I don't know whether this will be offensive or not, but when I saw you, like the overall image, I thought like without knowing you are a doctor, I thought you are a tycoon in Las Vegas. So it's like very fancy hotel, like luxurious. So it's like a very interesting personality plus like your very serious like a medical care like a experience and knowledge. Plus you are the author. Plus you are like a technology like a very nerdy geeky. So I think those combination make you like a very unique person. Yeah.
Yeah, well, I appreciate it. Thank you. So I like combining, just like I can say I was the first person to write a book on ChatGPT and healthcare. I went ahead and wrote a book on the rabbit and healthcare. And so
how do you do it? Because a lot of people, I mean, I saw a lot of, first generation always bad review. So what do you think about rabbit?
Yeah. So again, for me, it's a proof of concept. How can I combine this device? How can I use this in healthcare? So let's go over why I think this would not, again, this is just proof of concept theory, but why I think this can beat the iPhone. And you're like, there's no way this can beat the iPhone. There's no way. Let me explain.
Yeah.
Now I'm going to put on my CEO hat of a hospital.
Okay.
If I have to do something in the hospital and I have to buy everybody iPhones, that's going to be at least $1,000.
Yes.
At least.
Yes.
If I have to do the same thing and I can figure out something that's maybe $200 to do the same function, right there, this will beat out the iPhone because of cost.
Oh, cost.
If, let me give you a real example. God forbid someone comes into the hospital and they're having a heart attack.
Yeah.
And when they have that heart attack, every second that passes, their heart muscle is dying. And if you don't act soon enough, if you wait too long, that person's heart can be so dead, part of it, that they either die or that whole part of their heart dies, and then their heart doesn't function. With that in mind, if I had this device, again, assuming it's HIPAA compliant, meaning it has security and no one can hack into it, just assume that for a second, and I take a picture with this of the EKG, now this device, I can say code heart attack. And if I have this program that automatically it takes that picture and it sends it to the hospital administrator, to the cardiologist, to the team that's going to come to the hospital, and it does it all within seconds. Now it's done. Now it's saving lives. Now you can say, oh, we can do an iPhone app like that. You could, but I'm saying again, these type of devices, being able to do that quickly and send it and communicate overnight, and this would only cost $200 with Wi-Fi. So I think that's one way we could use it in healthcare.
Yeah, because when I saw a lot of like a YouTuber, they are trying to order like a pizza or something, and they complain about it. Like, why not I just open my DoorDash? Why I need that in between? But I think your use case makes sense because for people who order pizza, they probably has time sit there and trying to scroll which pizza. And but for healthcare, every second is crucial. If something go faster or kind of like especially emergency room. So if we can get the action as soon as possible, then we can save more life. Yeah. Cool. And also I saw you have like a Dr. GPT. Can you tell us like what's Dr. GPT? And I saw you have a lot of book talks about ChatGPT and healthcare.
Yeah. So over time, my friends, I've been educating them how to use AI. I've been pairing AI in healthcare. And over time, they've told me, hey, we're going to start calling you Dr. GPT because everything you say, you're combining doctor and GPT, and it's
Mhm.
blowing up our mind how to do stuff.
Mhm.
And so I like the name. And so now on all my stuff, I put hashtag Dr. GPT.
Mhm.
And so how to use ChatGPT in healthcare. Let's just, again, I spend a lot of time with just conversation, simple stuff. How many times that you go to the doctor and they're typing and the computer's over on the side and they're looking away and they're like, yeah, yeah. And it doesn't make sense because you're right there. My body is over here.
Mhm.
But if I use AI to transcribe the conversation now, I don't need the keyboard. Now I can
Oh.
spend time with you. I can look in your eyes. I can look at your body language. I can
Mhm.
see you walking in, walking out. There might be things that I would have missed because I'm looking away. I'm typing. I'm not looking at you. So that's one
Oh.
simple way of using AI
Hmm.
so that it's listening, it's transcribing, putting it into the electronic medical record.
Yeah.
Now you're getting better care. Now you have me. You have all my attention. I am
Yeah.
looking at you and I can do better. Plus, that humane side,
Yeah.
you feel more connected. But
Yeah.
if I'm on my phone, if I'm looking
Oh,
away,
yeah.
it's not going to work. Even if I have the Apple Vision Pro, if I have those on and I have a TV screen that
Hmm.
everything I see is there and it's very transparent, you're
Yeah.
going to be like, oh, I see what he sees and I trust and I understand. And I
Hmm.
have a question. I see you seeing that, doctor. What is that? And then I
Yeah.
explain it.
Yeah.
That's better than me having a computer right here typing and not sharing your information or anything.
Yeah.
And so that's
Right.
one simple way of let's use AI.
Yeah. And
Another,
yeah,
go
go
ahead.
ahead.
No, no, go ahead.
Oh, yeah. It just reminds me of like the a long time ago, I went to Taiwan's hospital, and the doctor typed English, like just like you said that like English, everything English, but we speak Chinese, and it's like a very hard, especially for the kind of like a professional terms. I still don't know what's going on with me, and especially a lot of 2D pictures. So when doctor turn the monitor, tell me what's going on, and I just saw a lot of like doctor notes. It's all in English. So I saw a news that somebody wants to change the diagnose from doctor in Asia or in China, in Taiwan. They want a doctor to write Chinese. Yeah, it's just
Mm.
like catch my mind. But go ahead, please.
No, the other part that I wanted to say is there's different people
Hmm.
with different backgrounds, different
Hmm.
languages. Even here in the United States, I'm here in Texas. If I speak to someone in the east part of Texas, they may be very country, they may be used to seeing certain things.
Hmm.
And if I speak examples and I don't use examples in their area, they don't
Oh,
understand.
yes.
If I speak what I'm having a conversation with you today, and we do this in
Yeah.
Silicon Valley, they're like,
Hmm.
oh, yeah, high five. We've heard of the Apple Vision Pro. We heard of that. We know that. They're just like, come on, let's go. But if we have this conversation
Hmm.
in a small town in
Wow.
Texas,
Hmm.
people will be like, what are they talking about? Like, I
Yeah,
don't
right.
understand. And
Oh.
so my point is this: why not use AI
Hmm.
to bridge the gap? Why not
Mm.
use AI so that when
Hmm.
I speak to you and I use examples for where are you exactly? In California?
Silicon Valley, just like you
Silicon
mentioned.
Valley.
Yeah. Hmm.
Perfect. So when I speak to you and I give you examples of Silicon Valley or customs or things, then you get it. And
Yeah.
so why not use AI to help me speak to you? Why not
Hmm.
use AI to really describe things? And
Hmm.
so even the way I speak to you, there's different cultures, and
Yeah.
every culture there's certain words you cannot use, and there's
Yeah.
certain customs. Some customs you're not supposed to talk to the patient, you're supposed to speak to the spouse, so the spouse
Oh.
speaks to the patient. But if I
Oh.
don't know that,
Yeah.
I
Right.
may insult them and not know it.
Yeah.
But if I'm using AI to help me understand my patient, be more
Yeah.
sensitive, give them the
Hmm.
right information and
Hmm.
speak to them. Now this is the other part.
Yeah.
Imagine
Hmm.
you have a 5-year-old little boy
Hmm.
that's having asthma, and
Oh,
imagine that
eczema.
little child cannot breathe, and I say, oh, they're having asthma exacerbation. You're like, what is asthma?
Yeah.
What
Yeah.
if I took all the principles of asthma
Hmm.
and I put them through ChatGPT or AI,
Hmm.
and then I extracted the core concepts
Hmm.
and then converted that to a coloring book? And now when
Oh.
your child as 5 years old
Hmm.
has asthma, I can say, here's your coloring book that is specific to the
Oh,
child.
maybe
And so if
that
the
can be
child,
a Kindle or something, and people just click on the iPad, so it's a digital file, not print out. Yeah.
yeah. And so now the child can color the
Oh,
diagnosis. So it's a coloring book. And
oh,
so I can
wow.
print this in the office, and I can make it like, if you, let's pretend you have a son that's 5 and
Yeah,
he
yeah,
likes, I don't know, he likes Iron Man. So
yeah,
then all the cartoons that are made are Iron Man, but then the concepts of taking your medicine, when
yeah.
you're sick, tell your mom or tell your dad or tell an adult, those are inside the coloring book. And now when I discharge the child, I give them a coloring book. I don't give them a sheet of paper to the parents. I give the child. But I'm using AI to
Mm.
combine the AI, the way I speak, what I say, and what I teach in their language. And their language is a coloring book.
Wow, I think you have millions of ideas. That is very, very amazing. And you also wrote a book. I mean, I saw you suddenly have like a tons of books. And also one of the book is very interesting. You use like AI driven entrepreneurial and
Oh, yeah.
unlock entrepreneur success with AI. How do you see like AI unlock entrepreneur success?
Oh, yeah. So let me give you a little secret how I'm doing all this.
Hmm.
Every time I do any interview,
Hmm.
anytime I do any PowerPoint,
Hmm.
I take the transcription of it. So I'll
Hmm.
ask you later for a raw copy of the video, and I extract the text,
Yeah.
and then I put it into my own GPT. So my business partner created my own LLM, and all my PowerPoints, all my books, all my transcripts, all my times on Fox News, anything is on there. And so now when I write a book, I literally ask myself, what did I say for ethics? What did I say about this? And so now I
Oh,
can take all of those
wow.
principles, and it's telling me what I already said, and
This
it's
is
giving it to
great.
me. And then now
Wow.
when I'm doing a new device, like this device, I
Yeah.
can have a conversation with myself and extract what I've already said and other principles and apply it to this device.
This is very smart. So pretty much you use everything you've already said, fit into ChatGPT, and then have your own like a language model, and
Hmm.
then you start talking to yourself. You want to write a book. What will
Yeah.
you?
Yes.
Wow, this is very smart way, like feeding it as
Yeah, because this
yourself.
way I'm not giving it to OpenAI. It's my server, it's my private
Hmm.
LLM. I can use Llama 3, and that way
Oh,
it's
so
just
pretty much
me.
you use Llama like a Facebook's Llama, right? And you
Llama 3,
download
yeah.
download
Yeah.
the local AI machine, and then you feed your own data, and so everything's local.
Yeah. So it
Wow,
doesn't go to the cloud, it doesn't go to someone else.
wow, that is a brilliant idea because I saw how can you be so productive while you have all the innovative idea inside. So pretty much it's all previously all your publication or all your interviews you kind of conduct and make a language model and you talk to that language model and start brainstorming with yourself, AI yourself.
Yeah.
Wow, this is a very high level innovative way. So yeah, so how do you see that ChatGPT become the co-pilot of the healthcare system?
Healthcare, unfortunately, is very conservative
Mm,
and it's very
yes.
slow to change. It's okay. I
Mm,
understand why.
mm,
These are people's lives. If we
mm,
make a mistake, someone dies.
mm.
We need to be careful, make sure that it's secure. We'll make sure that this thing is not hallucinating. And so I understand.
Mm.
But there's the way I see it is, if we can take some of these core examples, like the example of the little kid coloring book, why not do that?
Mm.
If I can save lives and use predictive analytics and use the different LLMs out there to help people, why am I not doing it?
Yeah,
The problem in healthcare is, obviously, it's a good problem. The FDA has to make sure that it gives its blessings to say, yes, this is okay for the public.
yeah.
The science has to be sound to say, you know what, this is correct, that the LLM is not hallucinating. So
Mm.
the other part of this issue is this technology is exponential.
Yes.
Our organizations are logarithmic. And so
Oh,
as this exponential growth happens, our laws are very
yeah,
linear.
yeah.
And so there's a big gap. And the
Yes.
bigger the gap, that's why we see, why is the hospital using fax machines? Hospitals still use
Whoa.
fax machines. You know,
Yeah,
that
right.
doesn't make sense. But it's because our technology is so fast
Yeah.
and our laws and hospital systems are barely hanging on. The other part is money.
Mm,
If the hospital system is not making much money, they're not going to put money into the resources.
yeah. But
Something so. Go ahead.
where are the money? Because we all know that healthcare, this industry, make a lot of money, but you mentioned that hospital doesn't have a lot of money. Then are they going to the insurance or somewhere? Where's the money?
Yeah, no, that's a good question. A lot of money goes into just waste. For
Oh,
example,
just
if you go
waste.
to the emergency room
Yeah.
and you see a doctor,
Mm.
you may be out $5,000, $10,000 just to go to the ER. And you think $5,000, $10,000 for an hour
Yeah.
sometimes, where's that money going?
Yeah,
The
right.
reason it's so expensive is because it's not efficient. And because also, if there's 100 patients and
Mm.
say 20 patients don't have any money and they don't pay their bill,
Mm.
so then they raise the price for the 80 so that it could pay for the 20.
Oh, I
So that's one
see.
way. And
Wow,
so,
this is kind of like the really bad cycle because you raise the price, you make someone broke, and that person couldn't even pay for it. And the next one has to pay all the debt of the collector. Yeah,
yeah.
wow.
So from a healthcare is hard. Plus, we went into healthcare to serve.
Yeah,
So we don't want to deny care. We're not going to
yeah,
let someone die because they don't have money. That
yeah,
doesn't make
right.
sense.
Yeah,
But
right.
someone has to pay for that. So the
Yes.
government subsidizes, the hospital may subsidize. Some hospitals make lots of money, but the problem is it's different parts of the hospital. Maybe
Oh,
the ER doesn't make any money, but they
yeah,
make money on people that stay in the hospital and
yeah.
are having surgery. That's where they're making more money. And
Oh,
so it's relative
hmm,
how you say it. Now, to your point,
hmm,
who's getting the money?
yeah.
I'll leave it at, look up the top 10 insurance companies and how much each CEO made. And I guarantee you, no one made less than like 5 million. Some of them is like 20, 30 million a year.
Oh,
So the
yeah.
insurance companies are doing well.
Okay, okay. Thank you for the hints. Yeah, so this is like also like our healthcare problem. And you mentioned that you have your own staffing and billing, all those like administration, kind of more like a bureaucracy side or workflow side of the healthcare. How do you see that Vision Pro or Spatial AI helps with the more like a management of the workflow of the healthcare?
Yeah. I know it's scary.
Hmm.
I understand there's a lot of people, including doctors, worried that AI is going to take their job. I understand.
Yeah.
To answer your question, it goes back to just efficiency.
Hmm.
If I'm able to have my Apple Vision Pro and be more efficient, if I can speak into it and it's auto correcting and fixing my emails, or
Hmm.
as an administrator, being able to schedule the patient instead of me having to
Mm.
pay someone to be on the phone and make sure you come see me. But if I put that in a bot that is calling you and your
Oh, put it in a
verbal
pot.
talking to the bot can make the schedule happen, now I don't have to pay someone to speak to a patient, because now for the appointment being, it
Mm.
can make an appointment without a human being.
Mm.
The other thing
Yeah.
is, in
Hmm.
in the hospital system,
Hmm.
we're used to having a scribe. If I can't type,
Hmm.
we bring another person. They're
Hmm.
usually pre-med students that
Hmm.
all they do is type and ask questions to help me,
Hmm.
and they're just transcribing.
Hmm.
With that example that I gave you of AI transcribing,
Hmm.
that person's job is gone. And
Yeah, then
so,
yeah, we will have a lot
so
of people lose jobs. And how can they do? What can they do?
yeah, that's the $1 million question, no pun intended. What's going to happen? I think at the end of the day,
Hmm.
we have to have a human in the loop. We
Hmm.
have to have that one person to make sure that the AI is not hallucinating, that it's not doing something wrong.
Hmm.
And that's going to be job security. In
Oh.
healthcare, I feel that at least in my generation and the next couple of generations, they're not going to feel comfortable having a robot replace me and
Hmm.
just speak to the robot.
Yeah.
So I feel like, at least here in the United States, we're okay for a little bit. Now, the 5-year-old, the 10-year-old that grows up with the iPad and used to
Yeah.
technology, fast forward,
Yeah.
they may feel different. They may say, oh my gosh, I have only spent time on my computer. I've only talked to this. I feel more comfortable with the bot than I do with the human being. So I think later that's going to change.
Yeah.
So my answer is, number one, we need to keep up with this. We need to keep up with podcasts like yours, influencers, people like me that enjoy this, to follow me and see what we're saying, what we're doing, so that we're educating. And then don't just follow us, follow other people, follow our opposite, so that we can see both sides of the story.
Wow, I think you are very like embrace all the types of like different opinions. That I think that's why I think you are so innovative. You can see this technology while everybody was giving bad review, but you see the good side of it. I think that's like the amazing side of like what I think talking to you. I think it's like I would say live up my thoughts and my vision, because sometimes when we see Vision Pro, we always like if developer complain, you will see like, oh, it's blah, 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 like, oh, it's cracking, right? In Reddit, it's cracking, or like, oh, somehow there's a point that is so easy to crack, like those like detailed negativities, but you see the bigger pictures. Yeah. So, how do you see that? For example, like those like human AI, because you mentioned that for example, like in the future, Gen Z might not afraid of like being diagnosed by a robot. And also, I saw there is a startup in probably LA. They create kind of like a box, like a big, like a kind of like a artificial box where there are so many automatic like equipment. A person just get in, and there will be a auto scan of all your healthcare, and you got all the data, and you just laying there, and everything is automation, and there's there's no robot there. So it's just a room that has all the equipment, and you have an app, and you just get into that box, and later on it's like a health check or something, and the person raised a lot of money, and his vision is to have a lot of small box in the cities. So what do you see?
I've
Like,
seen it.
yeah.
I know there's a lot of doctors are upset about that technology. I know that Walmart closed down all their healthcare shops inside of their Walmart. So, there's a fight between, is this retail, or is this medicine, or is this good medicine? Because how are you paying $30? Who's paying the doctor? So, there's a lot of controversy.
Yeah, right.
I'm going to go back to my earlier statement. I truly believe it is human plus AI is better than just human or than just AI. Using your example, if I'm your doctor and I have this nice technology that I can put you into a box and get your specs and information and your health and scans, but then I put my human heart, my mind, my clinical gestalt of 20 years that's not in the AI, that is not out in a textbook, and I put it together and I give you the best care.
Wow.
And so I think it's together. Now, take me out of the loop and you just have that box. You're going to lose that personality, that doctor, that compassion, that human touch, that person that wants to spend time with you.
Yeah.
But if you put it together, man, it's going to be amazing.
Wow. So you can foresee that so the point is that human plus AI is the best, not just only human or only AI. It's the combination. Cool. Yeah. So do you have anything you want to mention at the end of the podcast? I know we are like at the end of the podcast.
Yeah. I do want to say, at the end of the day, have fun. Don't be scared of this technology. It's that curve where everybody gets excited and it's going to say, oh my God, it's going to do great, but then it really doesn't. But at the same time, we always overestimate long term and underestimate short term. So I'm going to tell everybody, let's have fun with technology, learn, and take your knowledge, your human side plus technology, and then create something with that. And I'll leave you with that.
Cool. Yeah. Thank you so much for Dr. Harvey. This is a very insightful, very compact interview. Yeah, with full of innovations. So thank you so much. And That's it for this episode. Thank you for listening. We release episodes weekly. If you enjoy this conversation, check out our other episodes on Spotify, Apple Podcasts, or YouTube. Support us by giving us a follow and a 5-star rating or subscribe to our channel and give this video a like. Thank you and see you next time.